Okay, let's go over some of the red flags here,
Yeah.
one by one. Let's start with infection.
Okay, so there's several red flags, and these are things that you at home can think about if you have back pain, if you have any of these things. If you have fever, chills, night sweats, waking up completely drenched, that could be a sign of infection or some other cause. If you have trauma, if you're very elderly, if you know you have osteoporosis, you may deal with a fracture. If you have some weight loss associated with some of your fever, chills, and night sweats, and you're not really thinking about that, that may be an underlying cancer. If you have history of cancer, you don't want to just let the back pain go if it keeps increasing, especially if you have severe pain that wakes you up from a deep sleep. That can be also a frightening thing. Another thing you want to talk about is if you're having neurologic injury that continues or persists, if your weakness in your legs has a difficult time now standing up from a chair and that hadn't happened before, you have difficulty walking and tripping, if you have numbness around your genitalia, we call that saddle anesthesia, if you ever lose your urine and you didn't mean to and that's never happened to you, or your bowel, those are all signs of something that could be pinching all the nerves. So we either call that cauda equina syndrome or conus medullaris syndrome, depending on where it is in your lower back. But those are things that need to be addressed emergently.
And what kinds of cancer are you talking about with back pain?
There's multiple types of cancer. A lot of times you have metastatic disease that goes to the spine predominantly versus primary tumors in the spine. And tumors and metastatic cancer means that it spreads from a different region, either prostate, breast, kidney, things like that.